Hey everyone, it's good to see you again. Today we're talking about something that could seriously affect how millions of Americans experience healthcare, especially those of you who are on Medicare or helping a loved one choose the right plan. The federal government is taking on some of the biggest names in health insurance: Aetna, Humana, and Elevance, accusing them of illegal kickbacks and even discrimination in the way Medicare Advantage plans are being sold. And what's surprising is not just the companies involved, but how deeply this may have influenced which plans people ended up with, especially those with disabilities. If you've ever felt confused during Medicare enrollment or pressured into a plan you didn't fully understand, this might help explain why. So stay with me, because understanding what's going on here can help you make smarter, more informed decisions moving forward. If you've enrolled before in a Medicare plan, let me know in the comments how it went for you. I read everything, and I think a lot of people will benefit from hearing your experience. And if this kind of calm, helpful breakdown helps you feel more in control of your financial choices, go ahead and subscribe so you don't miss the next one. So then, what exactly is the government saying happened here? Well, according to a federal complaint filed in Massachusetts, 3 massive insurance companies and 3 big-name brokerages, those are the people who help you pick and sign up for plans, allegedly ran a scheme that cost taxpayers billions of dollars over 5 years. The government says these companies used shady payments disguised as marketing partnerships or development funds to steer people, especially seniors, into Medicare Advantage plans that were profitable for the companies, but not necessarily the best fit for the patient. Now, if you've never really understood the difference between traditional Medicare and Medicare Advantage, here's a quick explainer. Traditional Medicare is run by the government. You can go to almost any doctor, and Medicare pays them directly for each service. Medicare Advantage, on the other hand, is run by private insurance companies. The government pays those companies a flat amount every month for each person they cover, adjusted for how sick that person is supposed to be. Sounds fair on paper, right? But here's the issue. Because insurers get paid more for healthier people, they have a financial incentive to avoid folks who might actually need more care. And that's where some of these problems start. So according to the Department of Justice, from 2016 to 2021, insurers were giving brokers extra payments, basically bribes, to push certain plans. Now, these weren't just innocent bonuses. The DOJ says they were designed to push people into specific plans that made the most money for the companies, not the best care for the patient. Sometimes, brokers even made it hard to sign up for competitor plans by removing links, changing website layouts, or rerouting phone calls based on your age. That's right, the plan you saw on the website might not have even been the full list. And if you called to ask questions, your call might have been redirected or filtered depending on your answers. That's not just sketchy, it's potentially illegal. You see, when you trust someone to help you with healthcare decisions, you expect transparency. You expect that your needs come first. But what the lawsuit is saying is that patients, some of the most vulnerable ones too, were being steered into plans that didn't cover their medications, didn't include their doctors, and cost them more out of pocket. And they often didn't know what they were agreeing to. And here's where things get even more concerning. The complaint also says that insurers were actively trying to avoid enrolling people with disabilities. You may not know this, but not everyone on Medicare is over 65. Some folks qualify earlier due to disabilities. The government says that Aetna and Humana worked with brokers to reduce the number of younger disabled people who signed up because they were seen as more expensive. So, think about that for a second. People with disabilities who already face so many barriers were allegedly being filtered out through web design tricks, called routing systems, and pressure from executives to bring those disability numbers down. There's even an internal email cited in the lawsuit where a broker was praised for lowering their under 65 enrollment. It sounds like something out of a business strategy memo, not healthcare. And all of this happened while the taxpayers were footing the bill. The money used to pay these companies and brokers, that's public money. That's your money. Now, I know some of you might be wondering, aren't brokers supposed to get paid? Isn't this just how marketing works? That's exactly what the insurers are saying in their defense. They argue that these payments were normal business practice, just part of how companies promote their services. And sure, to some extent, that's true. But the law draws a line. When payments are made to influence medical choices, especially when those choices affect vulnerable groups like the elderly or disabled. That's where it can cross into fraud. And remember, the law that's being used here, the False Claims Act, has been around since the Civil War. It's designed to protect the government from fraud, and it allows whistleblowers to come forward and file lawsuits on behalf of the government. That's what happened here. Someone inside the system saw something wrong, reported it, and the Department of Justice stepped in. So then, what does this mean for you? Well, if you're on Medicare Advantage or thinking about switching plans during enrollment season, it means you need to be even more careful. Ask yourself, am I being shown all my options? Is the person helping me making money from this choice? Am I being rushed into a decision? And if you're helping a parent, a spouse, or a friend navigate Medicare, this is a good reminder to slow down and double check. Not all help is helpful. Also, this lawsuit might lead to some pretty big changes. Lawmakers are already calling for more transparency in how brokers are paid. There may be stricter rules about online enrollment systems, and hopefully more pressure on insurers to actually serve the people they claim to protect, not just maximize profit. Now, I want to take a second to talk about the people caught in the middle of all this. I've heard from many of you in the comments who say Medicare Advantage has worked well for you, and I believe that. For some folks, it offers things like dental and vision that traditional Medicare doesn't cover. But when the system is abused, when choice is taken away, that affects everyone, and especially those who are already struggling to make healthcare work for them. Just pausing for a moment to share something important with you. Medicare can be confusing, and we've spent a lot of time looking for a partner we could genuinely trust. We've partnered with Chapter, a service we feel confident recommending for clear, honest help with Medicare. Chapter connects you with a licensed advisor who takes the time to understand your needs, whether it's your doctors, your prescriptions, or just making sure your plan fits your lifestyle. They help you compare all the Medicare plans available in your area, and their goal is simple: maximize your savings and minimize the hassle. Most people who use Chapter save around $1,100 a year. It's completely free, and once you're set up, you'll also have access to their care advocate team. Real people who stick with you to help with claims, plan changes, or anything that comes up down the road. If you'd like to speak with someone today, call 615-639-1937 or visit askchapter.org/money by clicking the link in the comment section below. One woman, all right, let's keep going, whose story was cited in the complaint, said she thought she was getting help from a broker. Instead, she ended up in a plan that didn't include her doctor. She had to travel 2 hours just to get basic care. 2 hours. Imagine having to do that when you're not feeling well, just because of how a website was designed or how a call center handled your enrollment. This kind of thing shouldn't happen. And if the allegations are true, it means that companies didn't just break the rules, they broke trust. So what's next? Well, if the government wins this case, the companies involved could be forced to pay back triple the amount of money they received, on top of other fines. But more importantly, it could reset expectations. Maybe it reminds everyone in the industry that patients aren't just numbers on a spreadsheet. They're people, and they deserve better. Also, it will be interesting to see how the administration approaches Medicare Advantage reform going forward. This could spark a bigger national conversation about whether we need tighter guardrails on these kinds of public-private partnerships. So, I'd love to hear from you. Have you ever had a strange experience during Medicare enrollment? Did you feel like you got all the info you needed? Let me know down below. I think sharing those stories helps everyone make smarter choices. And if this helped you understand what's going on, don't forget to subscribe. I'll be keeping an eye on this and other important news you should be aware of. Because this isn't just a story about healthcare. It's about fairness, about trust, and about what we want our system to look like for ourselves and for the people we love. Thanks for being here, and I'll talk to you again soon.